In the past, babies born with trisomy 18 were called incompatible with life and left to die. Today's story shows that philosophy within the medical community is changing. As proof, you'll meet the Dennis family and those who helped make the impossible happen. Stay with us. Rhonda and Russell Dennis of Indianapolis, Indiana, were already parents of 4 boys when they discovered another baby was on the way. Because the pregnancy came later in life, Rhonda's doctors kept a close eye on both mother and child. 37 weeks into the pregnancy, complications arose and Rhonda had a C-section. Lilliana Dennis was born on May 17, 2011. Shortly after her birth, doctors grew concerned and tested her for trisomy 18. So after she was born, did they immediately know something was wrong?
An hour into it, the doctor said, "I'd like to talk with you." And so then the lady went through and said, "She's got markers, you ought to test to see if she has them."
What were those markers?
Clenched fists is one marker. The ear a little bit lower.
They're set lower.
Hers are not radical, but a little lower. Those are 2, and the feet have a little bit of a rock on them.
They're called rocker bottom feet.
Those are 3 trisomy 18 markers.
And what did they do to test to determine?
Oh, they took blood from the umbilical cord and they send it off.
The initial testing, they told us that all the cells they tested showed T18.
Trisomy 18 is a chromosomal anomaly resulting in an extra chromosome. Children born with T18 can experience physical and mental delays, seizures, heart disease, feeding and growth problems, multiple organ disorders, and apnea. 98% of babies born with T18 don't live past the first 6 months. Lilliana was born with a large hole in her heart, developmental delays, and feeding and breathing problems. Like other T18 babies, she was given little hope of survival. Did the doctors give you any hope at all? I mean, when it was time to leave the hospital, what did they say?
Said take her home and love her.
Yeah.
Let her family love her.
He said, we want you to take her home and love her for as long as you can. And the doctor was very compassionate and that, but it doesn't give you a whole lot of hope. And that's where what we thought our path was going to, at least I really thought that's what the path was to be. I didn't know how long the Lord would let her live. I thought it was going to be a very short time. And I just started praying, and we prayed together that the Lord would give us the perfect amount of days with her, and that we'd do our best to have joy. Just when we did have, to have her, that we got to hold her and meet her, because 99% of them never make it out of the uterus.
After doctors offered no options for treatment, Rhonda, Russell, and their boys concentrated on spending time with and loving Lilliana. It wasn't until a couple months later they discovered reason for hope. While Russell was at a local auction, he met a woman whose granddaughter was living with trisomy 18. The granddaughter was 13 years old. Russell and Rhonda quickly began researching ways to help Lilliana.
I contacted the mom of the 13-year-old daughter, and they lived in Colorado, and she hooked me up with 2 or 3 different online support groups for trisomy 18. And it was still hard to get on there in the beginning because, it's still the shock of this new diagnosis and you don't know how all these things are going to affect your daughter and so forth. But eventually I started getting on there some more and, introduced myself to the other moms. And that was the best support because there's, moms that have lost their children, but there's a lot of moms too that have living children. And so you could get on there and ask questions, and these moms know how hard it is to find answers because there's so many kids that don't live. There's not much in the textbooks. And a lot of doctors don't like to treat them because their prognosis is so poor. And they're living with a child that's living. Their hope starts building more. And the other thing that was a really big support to us was one of our college students started a Facebook group for our daughter called Prayers for Lilliana. And so many people joined that. All these people were praying from all over the country that we don't even know. And so you start to think, well, maybe God has a plan for her to live.
Coming up, we'll meet the doctor who advocated for Lilliana to have a life-changing surgery.
Look around you. We're surrounded by people who courageously face difficult obstacles life has thrown in their paths. Tune in each week to meet people who show there are positive, godly solutions to tough, critical situations. This Emmy Award-winning show tackles challenging life issues such as abortion, stem cell research, and adoption, and shows every human life is valuable and precious. Join us for inspiring stories of people facing life head-on.
Rhonda and Russell Dennis knew if Lilliana was going to have any hope of living with T18, she needed to have surgery to repair her heart. After being informed by her doctor she wouldn't survive the surgery, they sought a second opinion. Dr. Sanjay Parikh is a pediatric cardiologist at St.Vincent Health in Indianapolis, Indiana, and had one prior experience with T18.
So I met with them when she was just under 4 months age, probably 3 months and 3 weeks or so. And of course they were very keen on pursuing repair. And at the very first visit I had told them that we had never done open heart surgery on anyone who had trisomy 18 or 13, partly because it's always assumed in the medical community that that may not be the right thing to do, and partly because parents had not maybe asked us for it. So I said that that if they were keen on getting it done, it should be done much sooner rather than later. In other words, I would not recommend waiting till she was 7 or 8 months and saying, let's see how she does another 3-4 months. If she's still around, we will operate, or something like that. Because that would essentially compromise her chances at having a good result. With that in mind, I said I will discuss this right away with my colleagues if they were keen on us proceeding with it. I said I will facilitate the process of going elsewhere if they wanted to go, where they had done more than one patient at least. And that would have meant Cincinnati or Ann Arbor, which were the 2 closest places. I said I will facilitate, I'll do whatever it takes to get it done.
That was the first real hope we had had. And
well, it was like a breath of fresh air. We went in there and I already knew how hard it was to get heart surgery accomplished for T18 children. And so I wasn't really listening to exactly what he was saying, because I was on the mom, path of explaining why she needed it and telling him all the details. And it didn't even click with me that he said that this is kind of how Down syndrome was back 40 or 50 years ago, and they didn't want to do surgery, but now they do it, and it needs to change for trisomy 18. And later when I thought about it, I just about fell over. It was the first real hope of somebody that really showed and said they wanted to treat her and that he would help us, see if we could get it accomplished.
Even though Dr. Parikh was willing to perform the surgery, he needed to form a surgical team and get the consent of his fellow doctors who'd be involved with Lilliana's care. Dr. Gary Wright is the physician ethicist with St. Vincent Health and heard the Dennis's case.
The ethical issues that come into play with this are I think they're grounded in the issue of whether it's medically sound in a patient with a profound genetic anomaly like this child to do a procedure that would not prolong life or extend their life, and consider the issues of the quality of life that this child has.
Now, initially the committee was split on its decision. Why did some of the committee members initially decide that surgery wasn't the best option?
Well, I think if you look at the natural history of patients with trisomy 18, there is certainly a very foreshortened lifespan, that the average lifespan is usually less than 2 years. There have been cases where patients live into their teens, but there was concern that other medical complicating issues might be in play, that the child might have other reasons that corrective heart surgery would not be without significant risk. My concerns were at the time that we look at what the quality of life issues are and that we see if we could improve those over a period of time and if it was reasonable to do the surgery for that purpose alone. The Dennis family was very reasonable in their expectations. They understood completely what this genetic diagnosis meant to them and their daughter. I think having known that they had reasonable expectations, it was I think, more reasonable to proceed with a discussion about corrective heart surgery. Now, other members of the committee had some differing opinions. There were some that felt that we, in a child like this, should, and I say like this, I mean one that has trisomy 18, should not pursue aggressive medical management.
At first, the ethics committee was split on their decision. How did you get them to change their mind and unify behind having surgery?
Well, I said, and like we came to this meeting not really prepared with words, you know, this is just a mom talking. I want my daughter to have surgery and give her a chance, and that there is a huge spectrum in trisomy 18 in the children's capability. And some of them, you know, are not able to live very long, even with extra helps and oxygen and everything. But there's this big spectrum. So what would you do if it was your daughter?
We didn't know till later that he had 4 daughters.
And that opened the door for the surgery.
Yes.
It did.
When we return, we'll see how Lilliana is doing today.
Whether you're a student needing answers, a parent needing help, or a concerned citizen wanting to make a difference, Life Issues Institute has the resources you need to put your values into action. Life Issues Institute is an international educational organization committed to protecting innocent human life. Life Issues Institute knows what it takes. That's why millions throughout the world turn here for help. Life Issues Institute has authored more pro-life publications than any other entity in the world, and its materials are printed in over 30 languages. Radio broadcasts, newsletters, and a website filled to the brim with the answers you're looking for are just a click away. Go to facinglife.tv and click on the link to Life Issues Institute to find out more about how you can change the heart of a nation.
Lilliana's heart surgery was a success. Her breathing and weight gain improved, but the main benefit will be longevity. Lilliana still has problems with feeding and now has a G-tube in her stomach. But with therapy and practice, her breathing and muscles improve every day. Now it's been over 6 months since her surgery. How's she doing?
We feel like she's doing great. She's doing really good. Our biggest thing is the feeding and you know, the spitting up problems that we're trying to get under control. But she continues to keep developing and learning new things with therapy, and she surprises us with some of the stuff that she, you know, is starting to do. But she's doing really good. She can move her legs and move around kind of that way with kicking her legs, but she's a little bit slower to learn the connection between moving her arms and her hands and reaching, so she's just kind of getting started. So there's play therapy, and then the, you know, working on her neck and that sort of thing. And because she has a little bit of that obstructive apnea, she has to have oxygen while she sleeps. And I do have a monitor now, a pulse ox monitor that monitors her oxygen levels and her heart rate. So it will alarm, and we only do it while she's sleeping because we played with it enough before her heart surgery and after, and realized she only needs it while she's sleeping. And so you can go to sleep, you know, with peace of mind. If there's something going on, it will alarm for you.
Some of the best support Rhonda and Russell receive come from their sons. 3 of their 4 boys still live at home. Nathan and Philip balance school with helping their parents, while their youngest brother Ethan loves spending time with his little sister. Do you get to spend time with your sister?
Yes, all the time.
Do you? And you like doing that?
Yes.
What do you and Lilliana do together?
Oh, I usually kiss her a lot and hug her a lot.
How about you other guys? I know you're busy with school and jobs maybe.
I mean, that's one of the things about living at home, I guess. We're around all the time. But yeah, we're around, so we get to see her all the time and, you know, kiss her and all that good stuff.
What kind of support have you guys been able to give your parents and your sister?
Well, just physically being here to help out and do stuff. I mean, she doesn't get out much. We do a lot of driving for Mom because, you know, she's with the baby in the back. You never know what's going to happen with her. So we always, you know, run around doing stuff with her for that, or occasionally we watch her, not for too long because we haven't gone through all the different trainings and stuff, but
there's definitely, there's so much that my parents have to do. I mean, we tried, you know, to help out here and there and little stuff that we can, but I mean, it's definitely never enough because there's always more stuff that needs to be done.
Well, she just turned 1 year old. With all the uncertainty, what was celebrating her first birthday like?
That was wonderful.
Yeah, that was a big accomplishment.
We invited the neighbors and we invited friends, and we had a good time. We had them all in the backyard, and we limited it to 2 hours and had food, and we had a balloon launch where the little ones that have gone on to heaven, people of this Trisomy community would write their names, and so we had a little balloon launch, 25 or so, that went up there, and it was just a nice time.
What's her future like?
That's up to God. I don't know. I mean, you know, God has a plan for everybody, and obviously she's reached people we would never reach. So we're along for the ride, whatever happens.
What would have life been like if you hadn't pushed for treatment for Lilliana?
Wow.
But she'd probably be in heaven, that's where she'd be. Which is not a bad thing, but God gave us to her, and we felt it was our responsibility. If she was going to die, she wasn't going to die because we were negligent and didn't try everything to allow her to have the life God had for her.
Is the medical community finally changing how they treat babies born with trisomy 18? Stay with us to find out.
Look around you. Every day, heroes abound in our country. We're surrounded by people who courageously face difficult obstacles life has thrown in their paths. Tune in each week to meet people who show there are positive, godly solutions to tough, critical situations. We'll tackle challenging life issues such as abortion, stem cell research, adoption, and abstinence, and show that every human life is valuable and precious. Join us for inspiring stories of people facing life head-on.
There's no question a bias exists within the medical community when it comes to trisomy 18, but Dr. Wright, Dr. Parikh, and the Dennis family have seen proof this is slowly changing. The change in how doctors now treat patients with Down syndrome is paving the way for other chromosomal disorders. But with the implementation of Obamacare, the rationing of health services would likely result in trisomy 18 patients not even being considered, which makes the evolution of the medical community even more imperative.
I think what it means to be an individual in society with a genetic anomaly, I think, is changing. As we have now more and more genetic testing that we can do with certainty, we're finding out that, many of us walk around with altered, genomes. And what that means in terms of delayed onset diseases or those that can be as devastating as one that this patient had, I think is changing our understanding of what it means to have a perfect genome versus what it means to have one that's altered. I think our exposure to patients with trisomy 21 in the past and seeing how well they can be integrated into society, live normal, healthy lives with the assistance of aggressive medical care has, I think, in some way changed our attitudes and extended our our empathy to those that are experiencing genetic diagnoses that may fall into other categories like trisomy 13 and 18. But persuading medical opinion takes decades. And I think as society changes its understanding and its approach, I think medicine also changes. I'm pleased as an institution that we came together and we collaborated in such a significant way. The case points out to me the importance of respect for human dignity, that every life is precious and is a creation of God. And if we look at that individual with a genetic diagnosis who is different than our own genome, I think this case kind of shows us that in many ways we need to pay a greater sensitivity to patients that come to us with this difficulty.
What would you say to the doctor who feels a trisomy baby shouldn't be treated under any circumstances?
Something I've been thinking of lately is if Lilliana was born perfectly normal with nothing that would be considered abnormal, I couldn't love her any more than I do now. She's a joy, and she takes more time, that's for sure. But you know, I love her just as much, and they need to be given a chance.
What advice would you give to parents who are facing this issue anew and fresh?
Wow. Well, first off, God's in control no matter what. I mean, we've just seen it all along the way. He has a plan for every child, even if they only live a few hours, you know, or a few days. You have to be your children's best advocate, and you learn real quick what that means. And you have to ask lots of questions and get second opinions, and then you really need a support group. It's very important. They've been a lifeline to us. They really have.
What do you think you'll remember most as years go on and you've got your own families and you look back at this time?
I would say definitely the strength that my parents have had throughout this whole ordeal. And